Hey, welcome to Healthy Time with Pierre Docs. Just a reminder this is for informational purposes, this is not medical advice. Please follow up with your primary care provider should you have any questions or concerns. Enjoy the episode. Hey,
Hey,
we're back.
welcome to Healthy Time with Pierre Docs again.
I am Ardarian Pierre, also known as Dr. Pierre.
And I'm David Pierre, also known as Dr. Pierre. And together we are Pierre Docs.
Pierre Docs. So today we're talking a little bit about the flu. And, we know it's high time for all types of viruses this time of year. Everybody's coming back inside and we're all kind of stuck to each other. And so we want to talk a little bit about the importance of the flu vaccine and overall how you can remain healthy.
So tell me more about the flu. What exactly is it?
Well, it is a virus. And as you may not know, viruses cannot be treated with an antibiotic. So flu, also known as influenza, you will have symptoms of a sore throat, cough, muscle aches, body aches from head to toe, just overall feeling extremely fatigued and tired. So those are a few symptoms of the flu.
Okay, so those are symptoms of the flu. We're going to get into this later, differentiating flu from COVID and the common cold. But tell us a little more about what can we do to prevent the flu?
So from a prevention standpoint, some of the main things are just the simple things. Remembering to wash your hands. Wash your hands. We tell our kids that all the time, but washing your hands for at least 30 seconds. So long enough to sing the happy birthday song. If you are not in a situation where you can wash your hands, you can use hand sanitizer. As long as it's 70% alcohol, then it will certainly help reduce the number of germs on your fingers. And so once that hand sanitizer is dry, then you are deemed okay to eat or touch your face or what have you. So that's one thing you can do to prevent the flu. Secondly, it's transferred or transmitted by respiratory droplets, which means when I cough, like you do to me all the time.
Yeah, for me.
When you cough or sneeze or touch your face, wipe your nose and touch other things, then if someone comes behind you and touches without cleaning their hands or what have you, then there's a risk for getting the flu. So what else? What did you ask?
Who's most at risk for getting the flu? For it being transferred? Because with our immune systems, we can get ill or we can get a bacterial infection or viral infection. Sometimes we will not even know because in most healthy individuals, your immune system would fight off these infections.
Mm-hmm.
So let's say you have a family member. What family member would you tell be careful during the flu season, which you will also touch on when that is?
So especially if you're younger than 6 months of age, because less than 6 months of age, you are not eligible for the flu vaccine. If you have family members who are over 65 years of age, highly recommend that they get the vaccination.
When is the flu season?
The flu season is considered October to May. This can be a regional thing, so it may vary depending on where you are. We highly recommend that you get it by the end of October. So oftentimes in our clinics, we get them in mid to late August, sometimes early September. So getting it anytime before late August will deem you, vaccinated and protected from the flu, and as late as May.
And the number one way to prevent getting the flu is?
The flu vaccine, of course, the flu vaccine.
Right.
So that is our key to prevention.
Right. And who's eligible for this vaccine?
All right. So if you are older than 6 months of age, you are eligible. Anyone who's pregnant should get the flu vaccine. If you're immunocompromised, so if you've been diagnosed with a type of cancer or a disease like lupus, anything that can dampen your immune system, then you certainly need to be vaccinated.
Okay.
Again, those older than 65 years of age also.
Okay. Who should not be getting the flu vaccine? Or
Well,
who should be cautious about getting the flu vaccine?
Well, of course, if you have an allergy, so if you have a known allergy to the vaccine, then you should not be vaccinated. There was a time historically when we recommended anyone who has an egg allergy to avoid the flu vaccine.
Mhm.
However, that is no longer the case. So even if you have an egg allergy, you are eligible to get the flu shot.
What side effects should one look for if they do receive the flu vaccine?
So first, let me say that the flu vaccine is not a live virus. That means you will not get the flu from getting the flu vaccine. However, you can potentially have side effects. I know one of the main things is the site where you are injected will be sore. I absolutely hate that. Sometimes the soreness, sometimes my arm actually swells and is sore for a day or two, and I make him rub me down. But soreness at the injection site, redness at the injection site, and just feeling fatigue, potentially feeling sore. Those are some side effects that you very well may experience. Some have also reported nausea, feeling nauseous after it. Now, these side effects are normally short-lived. So again, a day or two and you should be able to bounce back.
Okay. So I got vaccinated.
Mm-hmm.
I'm doing everything, washing hands, staying away from sick kids, everything. And in early December, I happened to get the flu.
Mm-hmm.
What do I do?
What do you do? Well, go see your primary care physician. Please go ahead and see them. Get evaluated. You can be tested. It is considered 40 to 60% effective.
Are there any medications I can get after I get the flu?
Yes. So Tamiflu, if you have not heard of Tamiflu, it is an antiviral medication that is often recommended within the first 48 hours of symptoms. Now, the way this medication works is it reduces the duration potentially. So that, again, it's not 100%, but it can reduce the duration of your symptoms so that if you were going to be sick a full week, 7 days, then the goal is to reduce your symptoms.
Okay. Unfortunately, I got the flu. Despite washing hands, staying away from sick contacts, went to my primary doc, gave me Tamiflu. It's day 7 and I'm still not feeling well. What else should I do? How long should these symptoms last? And what signs should I look for to go seek help somewhere else? Is like an urgent care, or should I go to the emergency room? Mm-hmm. What signs should I look for after how many days of having the flu?
Gotcha. So I will start by saying all of us are different, right? I may have the flu today and only have it for 3 days. You may have it 7. I think on average about 5 to 10 days is the duration of it. It could be less, it could be a little bit more. Now, if you find that after doing all the things, you're still experiencing symptoms, some alarm symptoms to look for to say, I may need to see my primary care provider. I may need to go to the emergency room. If you're having shortness of breath, if you're experiencing chest pain, if you're unable to get out of bed, even after hydrating and taking Tylenol, Tamiflu, what have you, you're unable to get out of the bed, then those are concerning signs and symptoms to say, let me talk to someone, let me get evaluated and make sure everything's okay.
Right. And as she said, if you're unable to get out of bed, if you're unable to do your activities of daily living, which is getting up, showering, brushing your teeth, making your meals, doing your daily chores. If you're unable to do that because you're so fatigued and your muscles ache so much, if you're unable to eat appropriately, if you're unable to drink the liquids necessary, such as water and whatever you're used to drinking, if you can't do that, if you have any nausea, vomiting, diarrhea, any of those symptoms of abdominal pain that just persists for 24 to 48 hours, some people have a pulse oximeter to check their oxygen level. If it's less than 92%, you need to go seek help in your local emergency room or hospital or urgent care so that they can further treat you.
Mm-hmm.
And so then that question may be like, well, what's the next step if I do go to the hospital and get treated? What would be the next step? And I guess that would be for me to answer because I'm the hospital
give us your
so,
hospital list.
So if you do come to the hospital and your oxygen saturations are lower than what I said earlier, you'll be put on oxygen most likely. And what we do is conservative management. Most likely start you on IV fluids, check a chest x-ray, because oftentimes if you're going ill that long, you may have a co-infection also, which is just another infection. Sometimes it could be pneumonia on top of having the flu. So we'll give you antibiotics at that point because most likely the pneumonia is viral. And like I said, IV fluids, rest, any fever, we treat it with Tylenol or ibuprofen if you don't have any kidney issues. And basically just conservative, what we call conservative symptomatic care, treating the symptoms. So that's the flu, I think.
That pretty much wraps up the flu.
So we also have, unfortunately, we still have COVID around, and that's similar to the flu, but somewhat different. And we also have the common cold, which we can experience at any time. And as you know, having a summer cold is probably one of the worst things you can have health-wise in perspective of what we're talking about. But tell me more about the differences between symptoms with the flu, symptoms of COVID, symptoms of the common cold. What are some key things that you should be looking for that can help differentiate how these affect you?
Okay. So as far as the flu and COVID-19, they typically overlap. The flu is normally a pretty rapid onset. Like once you start noticing a symptom, it normally kind of takes off. You may notice, I have a sore throat. And then later on within the day, you may notice, body aches or nausea and more. As far as COVID-19, oftentimes those symptoms will take a little time. It's a gradual onset. You may notice one thing today, and then tomorrow you may notice a new symptom. So it normally takes its time to kind of start off. But overall, those symptoms overlap. Fatigue, sore throat, nausea, vomiting, not always vomiting, but nausea, some diarrhea, muscle aches, it's generally in both. As far as the cold goes, you'll have runny nose, you'll have sneezing, which you don't really have in flu and COVID-19. So sneezing is one thing that's not really present in those two. One more telltale, I guess it's not really telltale, but a common symptom for both flu and COVID is a headache. And sometimes I've had a lot of patients who were diagnosed with COVID-19 who simply complain of the worst headache of their life or a pretty severe headache that did not improve with medications like Tylenol or ibuprofen. And so with COVID, the flu, and common cold, all three of those can have a headache associated with it. And so if you have a headache that's lingering, that's extremely painful, you want to discuss that too with your primary provider. Otherwise, they can pretty much overlap. When we talk about things like breathing problems or shortness of breath, you will mainly notice that in COVID-19 more so than the flu. So you can have it in the flu, but more so in COVID-19. And typically in a common cold, you will not have any shortness of breath or breathing difficulties.
Okay. So what can we do to prevent COVID and the common cold?
Well, COVID, get vaccinated. I'm sure everyone heard us talk about keeping your distance when we had a surge of it. And we say the same thing now, maintain a distance from those who or who appear to be ill. If they're coughing, if they're not feeling well, keep a distance or use a mask. So for example, in my clinic, I don't wear a mask every day, but if I have a patient that I'm going in to see that I know has, cough, runny nose, sore throat, etc., I'm masking up. So let's say you have a flight. If you're on a flight, you're in a closed environment, you can't go anywhere, you may not be able to distance. I highly recommend wearing a mask. Let me also add that wearing a mask is a personal choice. So if that's something that you feel comfortable with doing, I recommend that you do it. And if you don't, then, cover your mouth, wash your hands, keep your distance as much as possible to stay healthy.
Okay. So I think all in all, we've touched on COVID, common cold, and the flu. Some of the takeaway points are always wash your hands, keep your distance, especially if you're sick. Remember also with the flu, you can transmit the virus maybe one day before you start having the symptoms, and maybe about 5 to 7 days after you start feeling sick. So that's important to know. With the flu, we have the vaccine that you can get. We recommend getting it in anywhere from September to late October, because the flu season peaks around January to March, right? We have COVID, which we recommend the vaccine also, and the same healthy practices of hand washing, avoiding sick contacts. And then with the common cold, same thing. There's no vaccination for that because there are tens of viruses that you can get the common cold from. Anything else to add?
No, and just keep in mind, if you have a cold or COVID-19 or the flu, antibiotics do not work for this. Antibiotics do not treat viruses. So definitely want you to keep that in mind as well. So sometimes we have patients, as soon as they notice a cough, or they're like, oh, Dr. Pierre, you don't need an antibiotic if we know that it's one of those three things, or if it's a virus.
So one concern we may have is, how does the flu affect one's mental health? And so that's an important question, especially since we are, in a good way, focusing more on mental health in these times. And I think one thing we have to be cognizant of is that we have mostly a lot of elderly people who get the flu. And we have the holiday times coming up. And a lot of questions I get asked is, can I go around my grandkids? Can I be around my kids? And I think that's important, because during these times when somebody's ill, we have to be mindful that they don't want to get other people ill as we're telling them not to go around other people. This may lead to some anxiety, some depression, which, is caused by isolation. How do we combat with that? Also, we know the flu, especially on top of dementia in our elderly patients, can cause some acute psychosis, some delirium. Give us some remedies for that. Give us some tips of how we can bypass that, or just face it head on, especially since you being the geriatrician, you have more experience with this outpatient, but you also have studied this for a while, and you can give us the answers to those questions.
So one of the main ways to really get through this, and it doesn't matter your age, it's just staying social. I tell patients all the time, almost everyone, right, they're utilizing their cell phone, playing games on the phone, what have you, FaceTime. So if you can't, let's say we have Sunday dinners every Sunday and you can't go this Sunday because you're not feeling well, FaceTime your family. And I encourage families to find a way to keep those ill family members who may not be feeling the best included in the normal routines. So FaceTiming, texting, calling, and if possible, like right now, the weather is really nice outside. You can see one another outside. So if you feel like getting up, moving around, go out and get some vitamin D, get some sun. Your family can come see you at a distance. That works as well.
And just a disclaimer, we're not promoting any Apple products when she says FaceTime. I think she means just any type of video call.
Any type of video call.
Video chat, whether it's WhatsApp or Google.
Yes.
Video chat. This is not a iPhone commercial
in
any sense of the word.
At the end of it all, it is vital to stay connected, encouraged, etc.
Right. So those are some things we can do. Check on your loved ones. Yes. Make sure you check on them. And as she touched on before, if you do have to go out, put a mask on. That will help reduce some of the droplets from being in contact with somebody else. You may have anxiety from going to the grocery store and touching the cart or giving other people hugs when you see them in social settings. And that's okay. You can let people know. You can use, if you go to the grocery stores, you can use those sanitation wipes. If it's a social setting, you may just let somebody know, hey, I'm not feeling the best right now, so I'm going to avoid any kind of physical contact, which is okay. And I think that will drive down your anxiety, just to let people know up front what's going on. And as far as the psychosis, delirium in people with dementia, it's important that we get a handle of these symptoms before, so we can quell those symptoms, reduce them so that those symptoms can go away. And that's just treating the patient appropriately.
One more thing to add, I'm trying to think about different options that we as people have now is Instacart. So, when you think about staying hydrated, if you need items from the grocery store and you have access to Instacart or Uber, what have you, you can get what you need dropped off at your door. Even medications. Remember when I ordered the Theraflu? Be careful with Theraflu, because I ordered that for David one day that I was at work, and they would not drop it off because it was considered a controlled medication, and I had to be here to sign it, and he didn't feel like getting out of bed. So you may want to look at things like that when you think about what you need to order, but it's a great option for getting the things you need to help you feel better, or you're not just kind of at home in need.
Yep. Good job.
All right. Well, thank you for listening. We appreciate you. Don't forget to subscribe. It is our goal to post something educational and informative every Friday. So we'll see you then.
Yep. See you on Instagram, YouTube, not TikTok or Snapchat yet, but that's coming.
Is it? Thank you.